Good morning, everyone. Thank you for joining us today as we share the main findings of the Jamaica Survey of Living Conditions conducted in 2018. The JSLC has been providing rich data annually since 1988, and it continues to be an invaluable resource for policy guidance and research. The survey is the result of collaboration between the Statistical Institute of Jamaica Statin, which fields the survey, and the Planning Institute of Jamaica that analyzes and publishes the results. The PIOJ is tasked with ensuring that the findings produced are accurate and remain relevant for policy and program design. Given these considerations, there is a process of review that is detailed and extensive, and it involves internal and external peer review. Statistical techniques and survey methodologies change and improve over time. Statin continually reviews its methodologies and framework to ensure that the best possible quality data are produced. And so, for the 2018 survey, changes were introduced to the sampling design and the weighting methodology. When significant changes are introduced, there is a process of internal and independent external validation that is pursued. With these changes, we do not recommend direct comparison with previous years until they have been revised. The details of the changes are explained in the technical appendices of the publication. To date, we have revised the 2017 data, which are included in the report. Subsequent reports will carry trend analyses as the prior years are revised. The survey was fielded during the months of May to December, with over 13,000 individuals from 4,547 households. We would like to say thanks to everyone who took the time to provide this most valuable information. The 2018 report carries 8 modules, which includes a special module on time use. I will now share with you the main findings from each module, and where appropriate, comparisons will be made with 2017. National demographic statistics show that Jamaica is moving closer to the advanced stage of the demographic transition, where there is a decline in the child population, that is, persons 0 to 14 years of age. The majority of the population is of working age, 15 to 64 years, and there is an increase in the dependent elderly population, persons 65 years and older. In 2018, a look at the distribution of the population by age showed that children accounted for 21.5% and the elderly a little under 10%. With a working age population of near 70%, Jamaica has a window of opportunity to improve productivity of this population for improved growth. The national household size continues to decline. The average size was 2.9 in 2018. The average size of male-headed households was 2.6, compared with 3.3 for female-headed households. Households headed by females traditionally comprise a larger number of children and other female members than those headed by males. Consistent with smaller household sizes, we are seeing an increase in the proportion of households with only one member. Single-member households accounted for the largest share of all household sizes. This was seen in all 3 regions. By socioeconomic status, single-member households were more common among wealthier households. Among households in quintile 5, 44.2% had only one member, compared with 15.6% of households in quintile 1. Moving on to health. Non-communicable diseases are a major health concern as they are the leading cause of morbidity, disability, and death in Jamaica and globally. In the context of the COVID-19 pandemic, we know that persons with underlying conditions are particularly vulnerable. In 2018, 23.9% of individuals reported that they had at least one of the 7 conditions that we investigate. There are distinct differences by sex and age. The reported prevalence of NCDs among females was 29.1%. This exceeded males by approximately 10 percentage points. By age, older persons have a significantly higher prevalence of NCDs. The most common NCDs are hypertension and diabetes. Among elderly females, 59.7% reported having hypertension and 29.4% diabetes. These proportions double that of males in the same age group. These estimates demonstrate the level of vulnerability faced by elderly persons with chronic illnesses. In exploring the use of healthcare facilities, we found that of the persons who were ill or injured during the 4 weeks preceding the interview, approximately 65.6% sought care. Half of those who sought care went exclusively to a public healthcare facility, 6.1 percentage points more than those who went only to private. On average, waiting time in a public hospital between registration and being seen by a healthcare professional was 2.9 hours. And in public health centers or maternity centers, the average waiting time reported was 4.5 hours. While the average waiting time in the public and private hospitals were similar, the waiting time in public health centers more than doubled the time reported in private clinics. Every other year, the survey captures information on the health status of children who are 5 years and younger. Households reported that almost all births were registered. 89.2% of children had received vaccines for preventable childhood diseases. In assessing their nutritional status, we found that 3.4% of children under 5 were undernourished and 5.9% were overweight. Under the topic of education, we see gross enrollment, which is it has consistently been high at over 95% from the early childhood level up to grade 11. For attendance during the 20-day reference period, 74.2% of children were sent to school every day. For those who missed some days from school, the main reasons for absence were illness, money problems, and rain. Among students in the poorest quintile, 38.5% reported illness as the main cause for absence, 32.2% money problems, and 11.9% said rain. Among those in the wealthiest quintile, more than half indicated that illness was the main reason. 11.6% indicated rain, and 5.7% money problems. Overall enrollment for persons 17 to 18 years was 67.8% compared with 66.7% in 2017. We observed that enrollment in 2018 for students in quintiles 1 to 4 were within 10 percentage points of each other. The disparity was greatest at quintile 5, registering 22.5 percentage points above quintile 4. For those 19 to 24 years, Overall enrollment was 15.9% relative to 16.8% in 2017. Enrollment among the poorest was 5.4%, with quintile 5 times higher. We also examined the educational attainment of persons 14 years and older who were not enrolled in an educational institution. These persons supply our labor force. 25.9% reported having some form of academic qualification that would allow them to enter and advance in the workforce. 21.6% had at some point enrolled in a skills training program, while 60% reporting having no certification. For those in the prime working age, that is persons 25 to 54 years, the proportions were slightly better. There is a module dedicated to early childhood development. In addition to the 8 disaggregated data provided throughout the report, this chapter explores key factors within the living environment and the interactions that influence the development of children 0 to 8 years old. Some of that information relates to stimulating activities and stimulating materials within the home. Respondents indicated that during the month preceding the survey, an adult in the household engaged in stimulating activities with 70% of children. The most popular activities were playing games and reading and showing books. Approximately 7 in every 10 children were provided with books other than school books. Other common materials were toys that teach numbers and toys that teach colors, shapes, and sizes. In relation to disciplinary approaches, the method most commonly practiced was corporal punishment. The most common corporal punishment method was slapping, administered with 67.3% of children. This was also the most common method used overall. Among non-corporal punishment methods, the most common approach was talking with the child about why their action was wrong. We also explored the types of psychologically aggressive methods, and the most common was quarreling and shouting. Let us move on to housing. The housing module of the JSLC includes data on the housing quality. So we look at the quality of the housing stock. This is shown in summary form through the Housing Quality Index that shows the proportion of households living in conditions that conform to established standards. Below are the 6 component indicators. In 2018, the HQI for Jamaica was 75.3%. Despite an HQI of 70.7% in rural areas, this region continued to lag behind the other regions in some of the indicators. We know that we are vulnerable to natural disasters. We observe that 72.6% of households live in dwellings that are to some degree structurally resilient. However, 6.2% have home insurance, which gives an indication of the proportion of households that have the capacity to recover after a disaster. In relation to drought, 60% of households reported that during the 30 days preceding the interview, they had at least one water lockoff. The average number of lockoffs was 7.6, irrespective of duration. 21.6% of households also use unimproved sources of drinking water as their main source. These include rainwater, rivers, lakes, and springs. We recognize the importance of having access to information and communication technologies, and this is particularly relevant in the context of remote learning and working from home. In 2018, 38.4% of households reported having a working computer. Of those households, 70% had a working laptop, 59.9% a tablet, and 13.1% had a desktop. 64.9% of households had access to the internet, with 35.2% having both a working computer and access to the internet. Under the Social Protection module, we examined participation in major social protection programs. The Program of Advancement through Health and Education PATH is the main safety net income transfer program to families. Using the household as a proxy, 61.2% of those that applied had received a benefit. Consistent with the program objectives, the majority of beneficiaries is from the two poorest quintiles. For other social protection programs, registration remains low, despite opportunities to provide income support and a supplement to the cost of healthcare. Food security is an important aspect of social protection. We need to know if households have access to and can afford adequate, safe, and nutritious food. Relative to 2017, a larger proportion of households indicated that they generally have sufficient food. In 2018, this was 62.7%, an increase of 4.5 percentage points. A time use module was fielded in 2018 to provide an understanding of how individuals 18 years and older allocate time for their daily activities. This data gives insight into the overall welfare of the household. Data were collected on time spent in paid work and household production, unpaid work, and personal activities. The average time spent on activities as a share of the day shows that persons 18 years and older spent more than half of the day on self-care and paid work. That's 55.8% of the day. The other main activities done during the day include using communication devices, unpaid care and domestic work, and leisure and social activities. Moving on to the household consumption and poverty module. Positive performance in the Jamaican economy between 2017 and 2018 contributed to an improvement in the household's ability to spend and a resultant reduction in the prevalence of poverty. In 2018, the poverty prevalence was 12.6%, relative to 19.3% in 2017. This was a decline of 6.7 percentage points. By region, the rate of poverty was highest in rural areas at 15% and lowest in the GKMA at 9.2%. The reduction ranged from 8.5 percentage points in the GKMA to 5.2 percentage points in rural areas. The poverty prevalence in other urban centers was 12%, a decline of 7.8 percentage points. The JSLC continues to be used by policymakers, researchers, other professionals, and students locally and abroad. We invite you to obtain your copy of the report and the data. The report is available for sale on the PIOJ's website and at our in-house bookshop. Persons can also access information through the Wesley Hughes Documentation Center here at the PIOJ. The dataset is stored at the Derrick Gordon Data Bank at the University of the West Indies. Thank you.